do you know that it can actually be difficult differentiating kidney stones from urinary bladder stones? Okay, here is how what you're going to be experiencing if what you're having right now is urinary bladder stones. Number one thing you're going to notice is that you have this feeling of heaviness at your lower abdomen. Okay, around that your pelvic region, you will be having a kind of fullness. So aside that fullness that you're having, you also be having pains, either lower back pain, okay, lower back pain around that region. So it's not like it will be as if you're having pain on your waist, or as if an extra load has been added to your waist. These are the key things that you're going to notice if you're having urinary bladder stones. So another thing you also notice that is also actually very, very important is that your urinary bladder gets filled on time. What I mean is that you get the signal to urinate quite often. Okay, let's say you urinated in the last 30 minutes, and normally on your normal you may still like 2 hours before you feel pressed again. But in this case, because there's a presence of a mass that is actually occupying a significant portion in the urinary bladder, you start feeling that urge to urinate. So it's actually very important that I state out at this point that urinary bladder stones comes in different sizes. It may be as small as a grain of sand, and it can actually be as big as a bulb. Okay, so this is just to tell you that it can actually be big. Then, because of the size, this urinary bladder stone, urinary bladder stone, because of the size varies, some of them can actually pass through the urinary meatus. So by the time they pass through urinary meatus, or while they are trying to force themselves through, look at the things that is going to happen. You may start noticing that you start seeing blood in your urine. You may also notice that you have difficulty in passing urine. You may also notice that while passing the urine becomes scattered. Your urine is not like the normal flow of urine that will just flow, but it's just like that they come out in patches. And at some point, you'll be passing urine. It's called that at some point the urine will not cease and also start coming out. These are the things that you need to be that you'll be seeing happening to you while you urinate, that you now know that what you are passing through, what you're having right now, might actually be due to kidney stone. So be due to urinary bladder stones. So if you also have urinary bladder stones, it's actually very important that you know a very important thing that you also notice is that you'll be having difficult passing urine. Yes, initiating urine at the first place. Apart from the one that it will cease while you're urinating, at some point, like I said, that the stone in the bladder, in the urinary bladder, can be as small as a grain of sand, and it can be as big as a bulb, or it can be as a small tennis ball, or even bigger than that, or even golf ball. Okay, so depending on the size, if it's very big, it can actually occlude or block that urinary meatus to the place where the urine is supposed to pass through, and this person may be having difficulty in passing urine. And by the time this person comes to the hospital, the first thing that may be done is to try to see if they can access the bladder through the urinary meatus. I don't know if you're understanding me. So look at one of the ways now to different, apart from all these signs and symptoms that you might be feeling, because a lot of other sickness can actually mimic this bladder stone, these descriptions we've actually given. So one of the ways to actually know if you truly have this is to do what we call abdominal ultrasound scan. What I say is to do an abdominal ultrasound scan. So abdominal ultrasound scan can be done in the hospital, or it can be done in an imaging center. It can also be done in any facility, scan centers like the one we have here, where we can actually show you what is happening per time. We deal specifically on urology cases and nephrology cases when it comes to scanning. So that's one of the major things we do here, because we want to give accurate and excellent results. So if you're interested in what we do, you can actually send me a message on the comment section or privately, and I will guide you on how you can actually reach out to us and how you can actually procure our excellent and precise service, because we believe so much in precision. So these are the things that you can actually see, and you know that by the time you finish this test, and this test tells you that what you're having is urinary bladder stones, you know that solution is almost there. I tell people, knowing what actually is wrong with you is actually very important in finding the solution. So a problem has been known is almost solved. So don't forget, I am Honorable Victory, and I'm your kidney health coach. Thanks for watching.